Welcome to the Faith and Gratitude Speaker Series, an educational program designed to bring you new insights on cancer wellness. We focus on practitioners and specialists that have an integrative, holistic approach to treating cancer and want you to have the opportunity to hear their views firsthand. The series is part of our ongoing commitment to providing empowerment and education to cancer patients during treatment and beyond. Today, Dr. Colin Champ, researcher and practicing physician in the field of radiation oncology, shares his perspective on the importance of incorporating both nutrition and exercise in cancer prevention and treatment. He is the Director of Integrative Oncology at Allegheny Health Network and head of their Cancer Institute Exercise Oncology and Resiliency Center. Listen as Dr. Champ draws from his research and deep-rooted heritage to create empowering lifestyle programs for cancer patients.
Hi, my name is Colin Champ. I'm a radiation oncologist at Allegheny Health Network. I lead breast cancer for the Department of Radiation Oncology. I also run the Exercise Oncology and Resiliency Center where we're sitting now, where we have all cancer patients, particularly breast cancer patients, undergo nutrition and exercise research protocols under my supervision and also under exercise physiology supervision. We're also all certified strength and conditioning specialists, so it's the only program like that in the country. I grew up 15 minutes west of Pittsburgh, so not too far actually from the Exercise Oncology Center. And I kind of have a roundabout way to how I ended up here running this program. The program really pushes the importance of both nutrition and exercise, but also really the importance of taking your own health into your own hands. And this really was imprinted in me from a young age. So I grew up, again, just west of Pittsburgh. When my parents were working, my grandmother would watch me during the day. My grandfather, about half of his yard was a giant garden, so he would take me out there and basically show me how to raise crops and vegetables. And at the same time, he was always working in his tool shed and in his tool shop. And so I saw the importance of both growing your garden, nurturing your garden, and then working with your hands. At the same time, my grandmother, a very nice and short Italian woman from southern Italy, spent a lot of her time in the kitchen. She was an amazing chef, cooking some of the foods he was growing. So again, reincorporating that, growing your own food with your hands, working with your hands, and then making it into a meal. So from a young age, I was shown that the importance of nutrient-dense foods, nutritious foods, homemade foods, eating packaged foods, and a lot of the foods now that we see in the grocery store in my house was really frowned upon. I mean, my grandma, that was heresy to my grandma to not cook all your meals. So that started me out, and we'll come back to that here in a minute, but that started out my views on the importance of nutrition. At the same time, my older brother was very much into sports, into exercising. I was into sports at a young age. So then that imparted the importance of activity levels, of exercise as well. So I was lucky in that regard. Now, when I went to college, I studied engineering at MIT, and so really didn't do a lot of that. I mean, I coached people, I wrote nutrition regimens for people, I wrote exercise training regimens for people, and that really pulled me into medicine. And then when I went into medicine, the engineering background pulled me into radiation oncology. So part of it was that, and then the other aspect that I really loved of radiation oncology was how much you got to interact with people. So when I trained, and I'm not that old, but things have gotten somewhat different. When I trained, individuals would undergo radiation for 6 weeks. So Monday through Friday, every day they would be in the clinic. I would see them at least once a week, if not more often, particularly if they had any side effects from the treatment, I'd see them more often. So these individuals, we would really form great relationships. Most of the time we weren't talking about the radiation they're receiving for their breast cancer. We were talking about where they were from, if we knew anyone, if our backgrounds crossed, what they were doing on the weekends, what kind of wine they were drinking, what they were eating for dinner. And I started to realize how important that aspect of care was. And so When I saw that, I realized that the number one, well, there's three main questions that individuals would ask me during treatment, and two of those had to do with food. Basically, what should I eat? Should I exercise was another one, and then what can I drink wine or can I drink alcohol was the other one I heard a lot. So the more I got these kind of questions, the more I realized that we weren't providing patients with great answers to those questions. Part of it was they're complicated questions, so I'm not necessarily criticizing medicine, but at the same time, there was not a focus on these areas. So I started researching to see what should we be telling cancer patients. So I'll stick with breast cancer. What should we tell a woman with breast cancer what she should eat? Should she be exercising? Should she be exercising during treatment? A lot of times when individuals are undergoing treatment, we tell them they shouldn't be doing anything, right? Sit on the couch, take it easy. And really the data shows that's probably not the right advice, particularly for individuals with breast cancer. They should actually be doing the opposite, so pushing themselves as hard as they can. And then in terms of nutrition, we have about a century of studies showing that there is an impact of nutrition. Now, a lot of these earlier studies are based on animal studies, so we have to be careful as to what we tell individuals. But what I did see, and what we're seeing now a lot in newer data, is there are things like body composition that correlate with outcomes. So the more muscle mass a woman has during treatment, the less adipose tissue a woman has, the higher chance of her cure. So what that started to do was reincorporate the importance, the necessity of asking these questions in the medical field, of answering those questions that patients were asking me, right? What should we be eating? Should we be exercising? These are important questions that we need to provide the answers to. So that, fast forwarding, that really led me to where I am now. So after training in medicine and in radiation oncology, I came back to Pittsburgh, where I was an attending physician. I left for a little bit to go to Duke University, where I continued my treatment of breast cancer, also lymphoma, and was at the Duke Diet and Fitness Center. So that really helped. I was mentored by Will Yancey, who's just a great person and a great researcher that was there. Really helped to cement my views on what questions I need to ask clinically and what research questions I need to ask. And so here we are now at the AHN Exercise Oncology and Resiliency Center, and we're asking all those questions. And what we've seen here, we also have a facility that I've worked with closely that we helped open in Naples, Florida. So we've had individuals on these protocols, on these exercise protocols for several years now. We have a robust database. We have several hundred individuals. It's, as far as I know, it's the largest database or largest exposure with such individuals in the world, again, as far as I know. And what we've seen is that breast cancer patients can do all the normal stuff that people without breast cancer can do. And I know that sounds silly, but what we also saw is that these women are extremely, extremely motivated. And I would argue they could do a lot more. And that's what we've seen. When they come into the gym, they push it harder than anyone else pushes it. 3 days ago, I saw an 80-year-old woman come in and deadlift a massive amount of weight off the floor. That was shocking to me and shocking to everyone else in the gym, because she's just so incredibly motivated. So number one is these individuals want to do whatever they can do to improve their health and to get better. And so if you were to ask me, what's number one or what can I do? I would say before we even answer that question, number one, realize during this journey, a lot of people are going to throw a lot of recommendations at you. And those are meant to help you, of course. But a lot of physicians are going to recommend different types of treatments. We'll all come together as a team to decide what's best, and you're still the quarterback, right? You decide what's best for you based on those recommendations. But the key there is these are recommendations of treatments that you're going to receive, and those are important. But the key here is that there's also things you can do to be in the driver's seat, and that's vital. Because you are in the driver's seat, you're in the driver's seat the entire time, whether you're getting radiation, whether you're getting surgery, whether you're getting chemotherapy, or whether you're getting immunotherapy. You can do things to improve your outcomes, like improve your nutrition, exercise, etc. So number one at the center here is to really empower women, and really we take all cancer patients here, of course, but the most that we see here are breast cancer patients. That's what I specialize in. And so number one is to empower these individuals. And this is best illustrated by the exercise programs. Because traditionally when someone starts exercising, particularly doing resistance training, you start them out slowly, you teach them movements, etc., and then you gradually increase. What we've seen is when we do it that way, adherence is not as good. So people will stop showing up for the exercise program. And unfortunately, it's just the truth. And if you look at some of the older studies, particularly in breast cancer, their adherence rates are about 50%. And one of the big keys here are women that are sent home to do an exercise program, women that aren't in a group with other individuals, there's no camaraderie, women that aren't given an exercise prescription. Those are the highest risks of falling off the map, of not adhering to the program. What we've seen is you bring these individuals into the class and you throw them into the fire, you push them incredibly hard from the start, they don't want to quit. In fact, they keep coming back. We have a 3-month program now. When it's over, they don't want to stop. They want to keep showing up. So it's a good problem to have. We have a lot of women who don't want to stop exercising. And what we've realized is part of that is because the program is so intense from the start, you get sore, you get really sore, especially the first 2 weeks. You do things that you never thought you could do. They're very difficult. So you see the progress and you don't want to stop. So that's number one. My number one point of advice is to push yourself very hard, realize how motivated you are, and realize what you can actually do. And again, we have women in their 20s, we have women in their 80s, and both of them push it just as hard. Obviously, we have skilled personnel here, so we make sure that everyone's doing it safely. But again, the intensity level is something that you would never expect. And then you walk in the door, you feel the energy, you hear the music, and you see how much these individuals can push it. Secondly, is everyone asks is, well, what type of exercise should we do? And then we can get into the science of it. And the science of nutrition and exercise oftentimes is all over the place. So you can pick and choose. And that's one of the issues here. And that's one of the issues where it's tough for your physician, your medical team, to give you exact recommendations, because there is not a lot of great data that clearly says this is what you should do. So we take the science that we've done ourselves or that we've read or seen, and then we combine it with our experience. Right? Again, we've had hundreds of individuals go through these programs. We see what works, we see what doesn't work. Number one is body composition. We've chatted about this a little bit ago. This has been shown in prostate cancer, this has been shown in breast cancer, colorectal cancer, lymphoma, leukemia. Almost at this point, every type of malignancy, we see that body composition correlates with both cancer-specific outcomes and overall health outcomes. So what that means is we don't look at body weight. We don't care what someone weighs. We don't care about their normal are they big bone, or they, all these terms. What we care about is muscle mass increasing and fat mass decreasing, and that correlates with metabolic health as well. So we do intense resistance training to get the muscle mass up. We do compound movements, so we do big types of exercises that you wouldn't normally expect someone to do, but they should be doing. So again, back to that 80-year-old woman who was deadlifting. We have her squatting. We have everyone doing these compound movements to start the workout. Gets the muscles, the big muscles contracting. It gets the nerves firing. Neuropathy is a big side effect of one of the chemotherapy regimens that women undergoing treatment for breast cancer often get. So we want those nerves firing so that we can improve that nerve function. We can improve muscle firing, we can improve strength, we can improve balance. These all kind of overlap basically, but a lot of women undergoing treatment for breast cancer are at risk for falls as is. They get neuropathy. It makes them at increased risk for falls. They're on anti-estrogen treatment, which weakens the bones. So what you see here is a whole cascading effect of weakness, neuropathy, weakened bones, at risk for fall. You see where it's going, a hip fracture. So that was a big thing that stuck out with me, is we don't want to put someone through all this treatment and then leave them at a fall risk and go and break a hip and end up in a nursing home. So when treatment's over, we want you to come into the gym. We want to stress those bones as much as possible so we can stop the bone loss. If anything, increase bone mineral density. And the way to do that is to stress the bones and stress them a lot. So the bones sense that, they get fearful that they could fracture, they lay down some more calcium and proteins, and they end up stronger. But to get to that point, you have to do these intense exercise regimens. And that's why we have you come in here to do it, to make sure it's safe. So that's vital. That's vital for really everyone in the population, but definitely if you're at risk for falls and fractures, and a lot of times that's going to be the case if you undergo treatment for breast cancer. So I could talk theory all day, but how about I just show you my ex-onc center? So when you look around the gym, you'll notice not a lot of machines, right? The closest thing to a machine is the cable cross, and that's really free motion. We have TRX bands, we have weights over here, we have kettlebells behind you, we have balls to work with, we have a sled over there. We have individuals push that sled and pull it. It's really a great dynamic way to work the legs and get in some conditioning. We have racks, we have, let me get this out of your way. We have hex bar deadlifts, which again, everyone that comes in here does this. Whether you're 20 or whether you're 80, I guarantee you can do a deadlift. If you have mobility issues, we actually raise them up on each side with different blocks. So everyone does this. We just account for mobility issues, and that's really the only limiting factor there. It's not your cancer diagnosis, your treatment, et cetera. It's a mobility issue, and we account for that. The other things to keep in mind is, since it's free moving, we don't have things like machines. So for instance, a lot of programs, they'll sit down and you'll do a leg extension. That's the one where you have the weight on your shins. You push out like this. It puts a ton of pressure on your knees. It's easier for us to do that because we can just put you on the machine, walk away. We don't have to worry about you. Instead, what we do here actually is have you hold weights at each side, or at least get to the point where you hold weights at each side. And one of the first things we have everyone do is what's called a split squat. And what that does is, on the way down, it loads your leg here. On the way up, it loads your leg here. When you start adding weight on, it's loading your hip and your spine. So it's doing things like stressing the bones, which we discussed. And something like that's going to make you more athletic and really stop you from falling and help put muscle mass on. Everyone hates that maneuver initially, and then they grow to love it because they all start using a lot of weight. We just had a woman who had really bad neuropathy. She got ACT chemo. It was really rugged. She had neuropathy for the past 5 years, came in, was falling all the time, left our gym, split squatting like that with 30-pound weights in each hand, which is really profound. But that's to illustrate that a movement like that is tough to do, but it's really gonna pay dividends in terms of how you feel, how you move, and your muscle mass. So the key here is not to have women go through their treatment and then just stop and be done. The key is, the way I view this, is increasing these exercise regimens after your cancer treatment. It's part of the treatment, right? It doesn't end. We always say this in the exercise oncology centers, it's a lifelong membership, right? You're signing up for this for life. We have a 3-month program right now for one of the exercise studies that we're doing, but it teaches you how to move, it teaches you how to lift heavy weights, it teaches you how to do safely, and then you can graduate to one of the sports performance centers. But the key is, it's a lifelong membership, and frankly, you're gonna feel a lot better because of it, and you're gonna be healthier overall. The other side of the coin is adipose tissue, right? So how do we gain muscle mass? Well, it's through exercise, it's through resistance training, it's through damaging the muscles, causing them to grow back stronger. Now, how do we lose fat? It's the opposite, right? It's by breaking down, but we want to break down the fat without breaking down the muscle. So you want to keep exercising so that you don't lose the muscle mass. And our protocol specifically does not do things like calorie restrict, starve people, complicated schemes. Some people like intermittent fasting, and that's fine. We work with them. But we do not do these extremely low caloric diets or very complicated nutritional eating patterns. We promote whole foods. We promote nutrient-dense foods. We promote cooking with your family. We promote not eating in the car, not eating processed foods. The study we're pushing right now is with a 3-day-a-week exercise regimen with a nutrition study that mirrors very similar to the Diet Fits nutrition protocol that came out of Stanford. Our nutrition protocol, again, is pushing high quality foods like they did in that protocol. We do try to minimize carbohydrates, as we found that allows people to generally eat less food. We've seen it as an easier way for individuals to lose weight, so that is one thing that we push. And then we also try to have them increase protein, because again, they're tearing a lot of muscle, stressing a lot of bones in the gym, and we want to preserve those structures. So again, it's increasing muscle mass and decreasing fat mass. And so you're going to go online and there's going to be a million different nutrition recommendations. You're going to hear this food's terrible for you, this food's great for you, and they're all going to conflict. At the end of the day, where the data is clear is that the more muscle mass you have, the less fat mass you have, the healthier you'll be overall. So the the nutritional eating pattern that gets you to that point is key. And that's, again, what we push here. So the next question is, what are the takeaways, right? So I'm obviously talking a lot about what we do. What are the takeaways? What can you as a individual who's undergoing this journey do? The first thing, again, is under safe guidance, and if you're on a specific treatment, obviously check in with your docs, because we certainly have different protocols for individuals receiving chemo or receiving radiation, or if you just had a surgery like a mastectomy or a flap or whatnot. So we have different protocols for each of those cases, but the key is to push yourself to the fullest. And we're really, really staunch believers in the exercise being intense. And walking is great, and I think the more you walk, the better. You should walk anywhere you can walk. You shouldn't drive. And walking is like breathing and like sleeping. The more you do it, you should be doing it an adequate amount. But it's not exercise in this capacity, right? It's not exercise to offset bone loss, to increase muscle mass, to improve your metabolism. So when you also increase muscle mass, it actually improves your metabolic rate at rest. So putting on more muscle mass has a lot of benefits beyond, certainly beyond just this diagnosis. So it should be intense. The weights should be heavy. Again, they need to be heavy enough to stress the bones. The numbers vary. Some of the data says, if you think about the stress that it would require to fracture a bone, we have to hit 10% of that to stimulate. There's these cells in your bones, and it causes osteoblasts. It causes them to migrate to the area where the stress is to, again, lay down some proteins, collagen, and calcium, and strengthen the bone. But if you don't hit that threshold, it's not going to happen. So if you get up to 1 pound weights and do curls with those, great. It's just not going to achieve what we're trying to achieve. And the next thing is in terms of muscle mass. When you're a beginner, the studies vary quite a bit, and it does show that even small amounts of exercise, resistance training, repetitions, etc., can go a far distance. But what we see is there's, again, a threshold. So you want to hit a certain threshold of a certain amount of repetitions and sets to see the largest amount of muscle mass gain. And again, people argue about this. Some say in as little as 2 or 3 sets per week, you're going to see muscle gain, and that's probably true. Others say you want to hit up to about 10 sets per week to see muscle gain. So as long as you're hitting anywhere in there, it's good. But what we try to do is have everyone hit the 9 or 10 sets per week. So again, we want to optimize. And when we push to optimize, again, it gets people hooked. They feel the soreness, they realize they're doing something very beneficial for their body, and they don't want to stop. So if you're at a point where you can only do a few sets per week, that's great. But if you can do more, do more. And most women that are treated for breast cancer, when they come through here, they could do a lot more. So we push them. So please push yourself. Number 3 is do it under expert guidance. So if you have the best are sports performance centers, certified strength and conditioning specialists, CSCS, It's a certification from the National Strength and Conditioning Association, the NSCA. These are generally individuals that train professional athletes. You should be trained like you're a professional athlete because it's the same, right? We want to have a prescription as to what you need. You want to increase bone density. You want to increase muscle mass, just like you're a pro athlete, right? You want to get bigger. You want to get stronger. That person who's coaching you better make you bigger and stronger, right? If you're a pro athlete and it wasn't happening and millions of dollars are on the line, you're going to find a different coach. We view it exactly the same. We test for a lot of different metrics. We test for muscle mass. We test for bone density. We test for fat mass. We do mobility screens, and we do a balance test. Our workout regimen has to improve all those. If it's not improving all those, we're not doing the right routine. And it should be the same with you, right? If you're not seeing an improvement, you have to change it up. And a lot of these exercise regimens have to be changed up quite frequently. So having expert guidance is key. Again, not every place has these types of centers. And I'm not talking about a trainer. There's nothing wrong with a trainer. I'm not talking about your neighbor. I'm talking about a certified, ideally strength and conditioning, CSCS, but someone with expert guidance to really figure out how you move, if you have any movement issues, if you have any injuries, if you're at risk of injuries. We put all those things into the recipe, of course, and then push you. Our programs are also generally movement-based, so I would recommend you do movement-based type of exercise regimen. So if you look around the facility here, you notice there's no machines except for the cable machine. Everything we do is free moving because we want to follow your natural movement patterns, right? We want to get you stronger. We want to keep you from falling, etc. A lot of times it's doing these compound movements, not have you sitting at a machine. A lot of programs will put you on a machine because there's in theory, lower risk of injury, but over the long term, that may not always be the best thing for your joints. So we put you on the floor right away. We have you moving. We watch you very, very closely, and I would do the same thing. So even if you don't have access to our facility, I would have you starting out doing compound movements, squats, these types of things that really stress your muscles and your bones. And then again, get adequate protein. We're trying to increase muscle mass, so you have to fuel your muscles, and it's going to be through adequate protein. We could argue all day long about what is the adequate protein for someone, A, with cancer, B, undergoing an exercise regimen. Numbers vary. We generally try to, if you have your body weight, we try to get basically a half of a gram or maybe a little more per pound of body weight, even up to 0.6 to 0.8. It gets tough to count these things out. I just recommend at each meal you have a good amount of quality protein. And then again, in terms of carbohydrates, people will argue about this, but bread, rice, pasta, even grains we're not huge fans of, but we try to keep those low because we found that helps people the best to keep weight off, to keep fat mass off. Vegetables, colorful vegetables, obviously, no limit to those. Eat as much as you can, particularly vegetables with chemicals in them that are beneficial, like Brussels sprouts, broccoli. There's sulfur in these vegetables, onions, etc. These chemicals stimulate your immune system. They also feed your bowel bacteria, the fiber in them. There's just really a lot of benefits there. So no limit to that. And then good sources of proteins and fats, nutrient-dense sources are really, in my opinion, good for everyone. So we don't tell people not to eat high fats, not to eat eggs, those kind of things. We recommend high quality sources of those foods with a lot of vitamins, a lot of nutrients, foods to keep you full, foods to keep you fueled throughout the day, and foods to keep you from snacking. And that's another big component. I would recommend to limit the amount of snacking, limit your blood sugar from doing this all day long, just like the Diet Fits protocol and the nutritional protocol that we do. That's been shown to correlate with fat loss. So as we pull all of that together, the way I compartmentalize this in my brain is there are the lifestyle activities that we can do to try to actually improve our outcome, and that's obviously the big picture item. And we don't know exactly what those are, right? We can't give specific and say this is going to improve your cure rate, X, Y, or Z. The studies in that regard are quite mixed, but we can do all these things to improve our general health. And that's really where the other side of the coin is, where a lot of these recommendations come in, is really what can we do to just be healthier overall? And that's likely going to improve our outcomes. And that's where these simple recommendations come in, right? Getting good sleep, getting 8 hours of sleep a night ideally, not watching TV before bed. These are the simple things that we can incorporate in our lives to really improve things. And that's where there's a lot of studies, we have a lot of studies pushing to say, how can we improve treatments? And I think that's vital. But again, at the end of the day, if you go through treatment for breast cancer, when it's done, you have to look in the mirror and say, what can I do? And that's where these simple, tangible changes I think are the most important, right? And again, I'll just go through, walk a lot. We just said sleep, sleep ideally 8 hours at night, good quality sleep. Don't snack, just eat a couple high quality meals per day, and then exercise like we discussed. There's a lot of data supporting those 5 strategies, and you really can't argue with that. Beyond there, in terms of the specifics, again, it just gets a lot more difficult to know what exactly is going to help me in the long run. So again, if you do those 5 things, I think it's extremely vital, and again, it puts you in the driver's seat of your care, because at some point, the physician that's helping treat you, that treatment's going to be done, right? Then it's up to you. So again, that's where you come in, and you can do all these components, which again, I view them as continued treatment. And so for those of you watching this skeptical on whether you can do such exercise regimens, I just want to go through some of the research protocols that we have currently. So we have a full-time center, 3 days a week. We have protocols for individuals that underwent treatment for breast cancer, prostate cancer, head and neck cancer. We have a metastatic breast cancer cohort as well. These are women ages 18 to in their 90s. We have women on all ends of the spectrum. We have men on all ends of the spectrum too in those age numbers. Weight-wise, we have 105-pound women and we have 300-pound women. Everyone does the protocol quite well, and everyone can do the protocol. Everyone can exercise 3 days a week and push themselves. 2 days a week, we have several other protocols as well, including individuals receiving chemotherapy. So we have individuals with chemotherapy packs on exercising. We scale up or down each day based on how they're feeling, but they exercise each day regardless, each day that they come in for the protocol. So if you think you can't do this, let me assure you you can. And it doesn't matter what level you're at, physically where you're at, what treatment you're getting. We need to make sure it's safe, but there's no skill level that says you can't exercise. So that's number one. So don't doubt yourself. Number two is, again, it's why it's that important to have someone with a good knowledge base helping you along the way. And again, as you do it, you're going to feel better. So as hard as it may be to start, the first 2 weeks are always the most difficult. After 2 weeks, everyone uniformly feels better, gets stronger, gets better at exercise in general, and then keeps going. So you certainly have to give it at least 2 weeks. But like I said, we see people of all shapes and sizes, of all diagnoses, and on all treatments, and there's an exercise program for you. So don't doubt yourself. Lastly, in terms of the nutrition recommendations, it's important to do what you can do, right? If someone's telling you you have to cut calories and eat some diet that's nearly impossible, we have to consider that. So a lot of the recommendations I've talked about before are what we've seen in practice that individuals are able to do. And there's data to support those as well. For instance, there's several dozen studies looking at calorie-restricted diets, particularly calorie-restricted low-fat diets, which has been kind of the stronghold of dietary recommendations. And then there's a comparison with studies that compare no caloric restriction, simply cutting carbohydrates. And they've tied about half the time, and then the other half the time, the non-calorically restricted lower carb diet has been successful. So that's data that we can say to patients Here's what's been successful for other individuals. It has not been low-fat, calorically restricted diets, so we don't recommend those either. So all the recommendations that I've discussed today, again, we know that you can do this. We know that individuals can do this, and we know that individuals all over the spectrum can do this. So I would challenge you to keep pushing yourself, to know deep down inside that you can do it, and know that what's important overall is that there's progress, right? It can be baby steps, but we're going to get to the finish line successfully. It just may take some time to get there, but again, it's a lifelong journey. And lastly, I want to thank Faith and Gratitude for having me here today, for all the great things you're doing, for your amazing cancer guide online. Please check out their website for more information, faithandgratitude.org. Again, can't thank them enough. These are services that are vital to the journey here, both during and after cancer treatment. So thanks again for including me as part of this.
Thank you for joining us today. You can learn more about Dr. Champ, his research, and lifestyle programs at colinchamp.com. At this time, we would especially like to thank our sponsors for making this special speaker series possible. For more education and empowerment during your journey to better health, visit us at faithandgratitude.org.